Well, good morning, everyone, and thank you for joining us today. My name is Marc Breslar. I'm the CEO at United Way Greater Victoria, and so pleased to welcome you to our third Local Love Virtual Cafe. This will be a smaller, more intimate gathering than our previous two, but hopefully no less informative. United Way is about community, and whether virtual or in person, we're most grateful for the opportunity to meet anytime. Before we get started, you will have noticed that you've been placed on mute, your camera is turned off, but you can still communicate with us. If you have a question or comment, please don't hesitate to use the chat feature within Zoom. I would first like to acknowledge that we gather today on the ancestral territories of the Coast Salish peoples, in particular, the Songhees and Esquimalt nations, and the Lekwungen-speaking people whose relationship with the land continues today. United Way's attention has been squarely focused on the COVID-19 pandemic since March. The Local Love in a Global Crisis campaign was quickly launched, and I want to thank all of the individuals and businesses who have donated, as well as government support that has followed. All donations stay local to improve lives within our community. On our last Local Love Cafe, we had the opportunity to chat with Isabel McKenzie, the seniors advocate for British Columbia. Today we build on that, talking about isolated seniors further, and a new program we have launched, which is in response to the COVID-19 pandemic, the Coordinated Meal Delivery Program for Seniors. In order to provide a frontline perspective on this program, I want to introduce two very special guests. First, Glenys Cavers, who is Director of Volunteer and Senior Services, Beacon Community Services. And as well, Renee Lorame Gulbranson, Executive Director, Oak Bay Volunteer Services Society. We're so delighted for your time and insights today. United Way is a proud funder of these two very important organizations who support our most vulnerable here in Greater Victoria. I now want to turn the program over to today's moderator. Jenny McLeod is our Director of Philanthropy here at United Way Greater Victoria. Jenny will introduce herself and also take us through today's program and serve as moderator. Jenny.
Thank you, Mark. Delighted to be here. As Mark said, I'm the Director of Philanthropy at United Way Greater Victoria. I'd also like to take the opportunity to thank our donors and supporters. It's because of you that we can do the amazing work in the community. So thank you for your continued support of United Way. Greater Victoria has one of the highest proportions of seniors over the age of 65, approximately 18% of the population of our region. As an organization, we are committed to investing in programs and services to support seniors in our community. I'm going to start off with a question to Mark. Can you share with our guests today, Mark, an overview of the United Way's Coordinated Meal Delivery Program?
Sure, thanks, Jenny. This really is in direct response to the pandemic. Isolation has impacted everyone, and it has especially exacerbated that within the seniors community. So what this offering provides is really twofold in scope. One is the fundamentals of meals and nutritious meals at that, as well as social interaction. So specifically in response to the need, we have convened and coordinated with 4 key agencies to provide food care, hampers, meals, and building upon a network of agencies, local businesses and restaurants to ultimately build and provide the offering. To put in perspective, there were about 90 meals being served per week prior to the pandemic, and we have provided a tenfold scaled increase in that. So building toward 1,000 meals per week, which had been the the target to attempt to maintain going forward. And I'm very pleased to say that we very recently reached 1,000 meals being delivered to seniors. This program is about building on that, so maintaining the level of nutritious meals being provided, but also to provide efficiencies, alleviate some of the pressures and stress on the agencies involved. And those agencies are represented here today in Renee and Glennis, Beacon Community Services, Oak Bay Volunteer Services, and the other two are James Bay New Horizons and Silver Threads Services for Seniors. So our role was really to launch, to coordinate, to convene, and very much now to introduce the kinds of efficiencies, learnings, to scale this program and build on it for the future.
Thank you, Mark. I'd now like to actually debut our Coordinated Meals Program video this morning. And so you're the first ones to see it. This video is created by Black Press videographer Arnold Lim, and we will watch that short video now.
Can you imagine what it's like to be months in your little apartment? Not able to go out, not able to get what you need.
A lot of them are, they're disabled, or they're blind, or
they have some memory issues, and using the microwave and the oven doesn't work for them anymore.
A lot of the seniors could be down to the tea and toast type of meal.
Having a hot meal brought to their house helps them to be able to continue on in their home for that much longer.
Beacon Community Services was founded in 1974 by volunteers, and to this day it continues to be a volunteer-led organization. What's important to me is that everybody has a chance to live their life as well as they possibly can. And what I like about Beacon is our motto is helping people and improving lives. There's a lot of people that are not seeing other people during the week. And we also know that sometimes we're the only phone call that they have and the only person they're talking to.
I find it pretty rough. And but I'm still on top.
The people who are most frail in the community needed this extra support. So I really appreciate the fact that the United Way approached us. We felt that this was a great fit.
Thankfully, we have the support financially through the United Way, and it's just showing them that we care about them. We're seeing them, we hear them, they're living on their own, they may be lonely and isolated, and somebody's reaching out and saying, here's a meal, we care about you. It's more than just a meal program, it's reaching out, and it's maybe a virtual hug through food.
Thank you. Thank you for knowing that it matters, for working to have the donations to fund something like this.
They're very compassionate, very loving, and I love them.
What a amazing video that really showcases the work that we do. I'd now like to turn it over to Glennis, Director of Volunteer Services and Senior Services for Beacon Community Services. Glennis, can you take us on a journey of the program from beginning to end? How does a senior register for the program, and how do they receive a meal? Oh, you just need to unmute there, Glennis.
Sorry about that. Thanks, Jenny. I was actually tearing up during the video. Seeing our clients like that is super special. So the meal program starts with the connection that a lot of our agencies have to isolated seniors in the community. We have 14 different partner organizations that we're actually working with to deliver services. And so the first place that we looked to deliver the services through BC 211 was our existing clients. And then we've been getting referrals from BC 211 throughout, well, the last almost 3 months now. And so when people sign up for BC 211, they can state whether they'd be interested in a meal program. And so it's really word of mouth, some advertising, existing clients in BC 211 is how we're finding the clients, or how the clients are finding us. Then what happens is a volunteer calls the client and says, "Are you interested in meals this week?" They say yes or no. Sometimes they have a choice of what meal they would like to get. We're delivering 3 meals per person per week right now. And they get a reminder phone call just to say, "Okay, remember that we're coming tomorrow." And the meal comes, and it's a combination of fresh and frozen, so the seniors can eat that night, but they can also save it for another day. Most of the entrees are big enough that some clients are actually getting 2 meals out of them. So volunteers come to pick up the meals. The local organizations coordinate with the volunteers and the clients and make a list of how they're going to drive around and on their way. Then they, either with a condo or a house, but they ring the doorbell and the client comes down, the senior comes down, and they give the meal. And then a really important part of this program is that we take some time to socially connect. So the volunteers step back, they have a conversation about how are you doing, is there anything that you need, is there anything that we can help you with? And then they say goodbye. And if there's anything that comes up, the volunteers actually come back to the organization. If they're concerned about somebody, they let one of the staff know, and the staff can then follow up. So that's basically how it happens from start to finish.
Wonderful. Thanks for that description, Glenys.
Yep.
I'm now going to turn it over to Marc. Marc, United Way of Greater Victoria has been collaborating with senior serving organizations across Victoria and the Southern Gulf Island for years. The work most recently has been focused on isolated seniors and the new coordinated meal delivery program. Now, why was it important for the United Way to step up and take a leadership and convening role to get this program off the ground?
Well, as the pandemic took hold, I think it'd be the understatement of the century to say it was a bit of a shock to everyone. So how to adapt. We at United Way have always taken a lead role on critical issues within community, and this piece around isolation, access to the basics around food and shelter was compelling and so apparent that we began to mobilize and focus specifically on that. We'll all recall, it was some months ago that generosity was becoming so evident and tangible throughout our community. We're also mindful to ensure we weren't duplicating, and so very focused on this cause around seniors. This pandemic clearly, as stated earlier, and as we'd all know, compounded that isolation. Part of it was helping identify where the seniors are located, how to access them. So we began to build on this through the local Love Fund. And then the federal government very generously earmarked through their New Horizons program some funding. We considered the seed capital, so to speak, to start building on this. And one thing led to another in terms of mobilizing an elaborate program to scale into future. And the need continues well into the future.
Thanks for that, Marc. I'd now like to bring Renee into the conversation. So Renee is the Executive Director of Oak Bay Volunteer Services. Now, Oak Bay has also been involved with the Coordinated Meals program from the beginning. Tell us a little bit about your community, Renee, in Oak Bay. What are the needs, and have you seen anything different since the pandemic?
Thanks, Jenny. As many people in the greater community know, Oak Bay has a large contingent of seniors The last census showed we have over 30% of our residents 65 years and older, which is, as Jenny mentioned, it's larger than the capital region's statistics, as well as BC and nationally. But back in the 1970s, our community of Oak Bay already had a need to support the senior population, which is why Oak Bay Volunteer Services came on the scene. Since that time, we've helped seniors remain living independently in their homes, which is a proven benefit, health and well-being, of course. The longer someone can remain in their home, the better it is for them. So with that idea in mind, our services respond to help address everyday living, from drives to medical appointments, opportunities for connection through visits and walks, and other services. But with COVID-19, many of these services have had to be drastically changed for the health and safety of our seniors. Because our services always have a thread of social connection, this has proven to be a challenge for us and all senior serving agencies. And for many of us, even our wonderful volunteers are seniors of the community, and they themselves have had to pull back their altruism to prioritize their safety and the safety of their families. But through challenge comes innovation and cooperation, which is why my organization and I are pleased to participate in the coordinated meal delivery program with United Way and our partner agencies. We do know our services have to be different, but they don't have to be non-existent during this time. And we think outside the box and rely on our partnerships and bring new ideas to light so we can continue to serve our seniors. A pandemic does not mean people are no longer in need. Seniors are living with health challenges, seniors are living in low income, and more than ever, seniors are living in isolation. And even those of us who would normally step in to help alleviate some of these challenges for seniors have had to rethink what this actually looks like. For Oak Bay, we certainly have risen to the occasion, but I know we do this in cooperation with many great organizations in the capital region, including Beacon and the United Way. And the meal program is one way we're doing this. So we're really proud to be participating right now.
Thanks so much, Renee. That was great. I now want to turn it back to Glenys. So Glenys, how did you guys, I think you spoke a little bit about this, but how are you determining which seniors are in need of assistance? Maybe you can kind of elaborate on that. And how many meals are required to support the seniors? Was there a needs assessment done?
Yes, thanks, Jenny. As I said before, we did have a way of accessing seniors through our existing clients. With Better at Home clients, which is a program that's supported by the United Way, they have to provide us with line 150 of their income tax. So we know how much, what their income is, and their sliding scale for different services is based on that income. So that's one way that we have identified. We've looked at our clients that right now, Beacon has about 1,000 Better at Home clients, and so we were able to identify the people who had the lowest income and the greatest need, and that's how we started. Then we looked at who we knew in the community that might have access to people who are physically isolated. So a lot of our volunteers are connected with different parts of the community. And so they've referred people. They might have somebody in their condo that they're concerned about, or somebody living in a house by themselves at the end of a driveway. And so what we were looking for is not just the income, but it's also about the actual isolation, because isolation doesn't have an income attached to it. Somebody could be living in $1 million house and be feeling very lonely. So we wanted to make sure that the people we were getting meals to, it was nutrition, but also connection. And with our community partners, they're all connected to different people, different seniors in the community, and most of our community partners also have volunteers, so they are using the same way, reaching out. It's amazing how what a difference it makes. People can't really believe that we're offering 3 free meals to them a week, and so as you saw in the video, they're thankful, but they're definitely more thankful that they're actually seeing somebody and having a little conversation.
Thanks, Glenys. I want to stay with you, Glenys, and I want to talk to you about, your organization has really been with us since the beginning of this program, and United Way was really the leader and the convener, but Beacon is really focused on leading the operations of this program. Can you talk about the mechanisms and systems that are required to coordinate and distribute meals across the CRD? And maybe you can discuss the storage, meal preparation, space, containers, and transportation. There's a lot of logistics that go into the program.
Yes, there are. I think one of the ways that we were able to ramp up service so quickly was that we had existing relationships with other organizations in the community. And the United Way of Greater Victoria has actually been funding a seniors planning table where we've had the opportunity to network and work together. So when this opportunity came up, I had the existing connections with different nonprofits in the area. And we had worked together before, and we were able to ramp things up pretty quickly. As far as the logistics, we have looked locally. So on the peninsula, we have the meals made on the peninsula, and the delivery starts from Sydney and goes out. In Victoria, the meals are made in Victoria, and then the same thing, the volunteers collect them at a certain point and drive them out. So we're definitely hyper local, as you say. We're using volunteers who live in the same community as the clients to do the deliveries. And we're also using agencies that, like Oak Bay Volunteer Services, that are in a community that they're actually serving as well. So the connection, what we're looking for is the connection to not just be a one-time thing. It's also with the organization's ongoing. And I think that one of the other connections is that we have the same volunteers when possible delivering to the same senior. And so that's helping with the connection. As far as food storage goes, we have a couple of big freezers, and we also have meals that are made the day that they're delivered. And so then the senior can decide whether they want to freeze some at that point or just keep them in their fridge and eat them for the week. And the 3 meals are what we've decided on. They also get like some cookies and some buns and some fruit, so that they have a little bit of everything, as opposed to just the tea and toast or opening a can of beans, which is what we know a lot of people were doing as they were becoming a little tired of cooking for themselves. So I guess the only other thing is that by using the different restaurants and organizations, nonprofit organizations that create the food, we've been able to keep the price of the food low and nutritious at the same time, so that everybody's getting all of their food groups and in a way that's nutritious, and also something that they didn't have to prepare themselves, but still home cooked.
Thanks, Glenys. I like the fact that you're keeping it hyper local and partnering with some local restaurants to keep the and community partners to keep the costs low. I think that's very important.
Yeah.
I now want to turn over to Renee. So Renee, I want to talk to you about volunteers. I know your organization is working with volunteers to make this program a success in your community. Can you tell us more about that?
Sure. Well, as all of our services rely on the time and talents of our volunteers, we would not be delivering the program without them. As we know, isolation has been elevated during COVID-19 for our seniors. This program not only ensures the provision of those healthy meals, but also that all-important connection to the community. And that's where our volunteers excel. And in some cases, our volunteers may be the only person that a senior sees or connects with in a given day, and potentially even a given week. There's so much value for not only the senior, but also many of our volunteers. We know many of them have had to pull back and quarantine themselves. Many of our volunteers are also community members who are retired, 65 and older, and they've had to pull back from things they love, including volunteering. So this program actually has created opportunities for our volunteers to come back in a safe environment, returning to volunteering after a hiatus. And I can see the happiness just from them each week, because I am a portion of the process in helping them get the meals or coordinated, and just seeing the real pleasure and the real enjoyment they're getting from being back in volunteering, and particularly for this program. And honestly, they love to serve, and they are members of Oak Bay. As Glenys mentioned, it's really community focused. So for them to continue to serve their neighbors is what they really love to do. So we're happy to be able to facilitate that, and this program is a wonderful way for us to do that.
Thanks, Renee, for sharing that. I now want to turn it back to Marc. So in order to scale up the program from 200 meals a week to 1,000 meals a week, how will United Way and the coalition of the 4 serving senior organizations source the additional food required for the increased meals?
Well, I think it's, I'll start by what I think has been thematic since the pandemic for we at United Way Greater Victoria and for many people and entities, and that is collaboration and innovation. So through this process, as has been identified by Glenys and Renee as we talk to the program, pulling together various parties, whether it's community kitchens, the Food Share Network, restaurants, businesses, how do we sustain that to ensure some of these very businesses are first and foremost concerned with their own survival? So how do we build on something that works for everyone? And I think that's very key. I do want to take a moment here to give a shout out to our Director of Community Impact, Danella, who really was a driving force bringing together the seniors table, where a lot of ideas have been put forth, and we, as Glenn has said, built on this through relationships. So specific to the question on scale, I think we'll talk a little further in the program to the mechanics of what go forward looks like, but it is about the innovation. We saw it in James Bay with a restaurant early on, jumping right in to help prepare, serve, and bring it together. A local rugby team that came in force to volunteer. And so really it's understanding the various parties, ensuring that the ultimate objective of nutritious meals and connectivity are met for our seniors, and enlisting everyone and understanding, frankly, what's in it for them. And ultimately is the rewarding delivery, but also it can help the businesses and the food network.
Great. Thanks, Marc. Now back to you, Renee. I know that you and your son were, when this was all starting, you and your son were personally delivering some of these meals to the seniors. Maybe you can share your own experience and how that was connecting with seniors in your neighborhood.
Sure, thanks. So yes, I had the pleasure of delivering our first week of meals to our clients. It was really, really quite lovely. I did bring my son, Matthias. He is 11 years old, and he is a budding volunteer. Not that I don't encourage it, of course, but it's lovely for him to have asked to participate with me. It gave me a chance to speak to our clients initially, just to get a sense of what their feelings were about the program. And as executive director, I have staff out normally in the community that does that kind of work. So it was really a pleasure to be able to speak with our clients. The clients were very excited to see us, and we had that distance conversation with them for about 10 to 15 minutes. Many of them, as Glenys mentioned, it is the opportunity to share in that connection. A simple delivery can be so impactful. Again, that health component of a freshly prepared meal is wonderful, but that connection for someone who lives alone and may not connect in person with somebody very often can be very impactful in their life. And so it was a real honor to be able to do that for somebody. Of course, bringing an adorable young man with me was very exciting for some of the clients. Many of them have grandchildren of their own that they haven't seen in a long time and really wish they could hug. So, although we were hiding behind our masks and wearing our, PPE protection, I promised everyone that under the masks were smiles, and we were so happy to see them. After the deliveries, we did receive some really great feedback, not only about how delicious the meals were, so we're really thankful we have suppliers that are really just dishing out some beautiful meals for folks. But folks were also really thankful to have this program. Not only is right now it's delivered for free, and that's so generous, and people are really surprised by that. But we know many of our seniors, we're delivering a number to people in their 90s who have a lot of physical or mental health challenges. And so this really was a nice break for them, not to have to prepare meals for themselves. And the meals are so hearty. As much as we give out 3, in many cases, 1 turns into 2 meals. So again, another huge impact just from that meal, but so much comes from as simple as delivering a meal to somebody. Just the value is there for the people personally, health-wise, but it really is a changing thing for them on a day-to-day basis, just to get a break from preparing a meal when they're really struggling.
Thanks, Renee. I liked how you touched on sort of the social and emotional benefits of this coordinated meal delivery program. I wonder, Glenys, if you wouldn't mind sharing about your organization and what have you seen in terms of the social and emotional benefits of the program?
Yes, thanks. I would say that one of the amazing benefits, that the feedback that we're getting from the volunteers who are doing the deliveries are just, they're so excited, they're so thankful that they actually get to do this volunteer role. We have people wanting to do more deliveries. They come back if we have a couple of extra people that we've been able to connect with, that's like, yep, I'll do a couple of trips. So I think that our volunteers who have also been physically distancing and isolating, this is a very safe volunteer role for them because they're maintaining their 2 meters distance, plus they've got their masks on, so they feel comfortable doing this. And making the connection with the isolated seniors is a very rewarding experience, I think, for them. The feedback that we've had from the seniors has been equally positive. They love the cooking. Most of our meals we're not doing gourmet, we're doing kind of home style things that have great flavor, but something that seniors really prefer. And the other feedback that we're getting is how nice the volunteers are, that they really appreciate having the conversation with them. We have calls and emails from the seniors just saying how nice somebody was, and they really appreciated them spending the time to find out how they were doing and just a little bit more connections. So we're definitely seeing the, I guess, we're doing and we're seeing what this whole thing was planned to do, which is making sure that seniors have nutritious, healthy meals as they live independently, and that they have some social connection to assist with their mental and emotional well-being.
Thanks for that, Glenys. I now want to turn it back to Marc. So United Way has been focused on phase 1 of the coordinated meals program, so really getting the program off the ground. What does phase 2 of the program look like?
Well, first off, as host, apologies. We don't control Zoom, but I think we've had a great 30-minute run on sound. So sorry for the odd breakup if anyone's experiencing that. Thanks for bearing with us all. In terms of phase of the programs, there's a lot of phases out there. We as British Columbians heard yesterday from the Premier on phase 3, from personal living, travel, etc. So we consider specific to the coordinated meals program that we enter phase 2. What we've talked about in terms of launch and setup has been very much about the first phase, how to mobilize, build this piece. Phase 2 is really about getting to the 1,000 meals, maintaining the infrastructure, continuing to improve with efficiencies along the way, and phases into the future from that point on will involve trying to maintain it to that level. So phase 2 specifically is about securing all that we put in place to be able to maintain the 1,000 meals per week. That involves the infrastructure, the various parties, the logistics around it, reporting requirements, and the additional administration and support by way of personnel to operate as absolutely efficiently as we can to deliver on the program. So we were all very pleasantly surprised to acknowledge that we just hit the 1,000. How do we maintain that into the future? Again, the needs have become no less. So let's secure this in place and find ways to keep it as efficient as possible.
Great, thanks, Marc. Now I want to keep it with you, Marc. You mentioned earlier that we received some seed funding, $55,000 from United Way Canada's COVID-19 Seniors Response Fund, and some from our generous donors to start phase 1 of the program. You spoke a little bit about wanting to sustain it and upscale it. What are some of the goals that you're hoping to achieve with the program? And what is United Way hoping to raise to sustain this program on an annual basis?
Again, sorry, it may just be my.
Oh, Mark, I think you're frozen there. Okay, oh, there we go. You're unfrozen. Do you want to try that again, Mark?
Do you want to take the Mark?
Yeah, sorry. Perhaps it's just the feed in this corner of the office. Everyone can hear me okay? All right. Specific to budget, we've been building on a combination of federal government funding along with generous donations through our Local Love Fund to this point. To maintain this program at 1,000 meals, the annual cost is $560,000, and that includes meal prep, delivery, all the things we've talked about, infrastructure support, and that does not quantify volunteer time and support around that. So 560K is what we aspire to do. We have funding in place that carries us really through the end of August, likely into September. And from that point, we begin to build through private donations, business, and that really is the compelling ask here, is to help work with us to maintain this program into future, with the assurance from us we'll continue to deliver on the goods of nutrition connectivity in as effective and efficient as manner as we can.
Thanks, Mark. So before we turn over to the audience and have some questions from the audience, I want to ask any final comments from our panelists, just to kind of wrap up the program. So I'm going to start with Glenys. Any final comments you'd like to leave us with?
I think I'd just like to thank the United Way for their leadership, and also our partner agencies that because everyone has been very willing to participate. And it is a gap that we saw prior to COVID. I think that COVID's brought some opportunities to reach more isolated seniors. And so this is a gap that we see not just during the pandemic, but we see this going forward. And as we continue to try and assist people to stay in their own homes for longer, this gap is only going to increase. So thank you very much for your consideration and support.
Thanks, Glenys. And then I'll ask Renee for any final comments.
Sure, thanks, Jenny. Yeah, I echo a lot of course, what Glenys has had to say. It is certainly more than just food. That connection to community is so important for our seniors. And during COVID-19, it is even more important than ever. I also feel sometimes our seniors are forgotten for other challenges in the community that maybe get a little bit more airtime. Aging is a journey we all go through. It changes our health, our independence, and our way of life. And today our seniors are living longer than ever, well into their 90s. When I speak to some of our 90-year-old clients, they admit they really never expected to live this long. Many of them have lost family and friends over the years and are also concerned about financial security, something that they have to be able to secure for the rest of their lives. I always extend the importance of ensuring dignity and belonging for our seniors. They've contributed so much to our communities through their lifetime. And so for me, we've benefited from that. So it's our turn to contribute and support them through the meal delivery program. It is one way we can do that. And my hope that today through this conversation, we'll be able to do that, see really great value in what we're doing, in something as simple as delivering a fresh meal to a senior. The impact is extensive, and again, I think it is our turn to thank those who have done so much for our community and throughout their lifetime and continue to. And this is just a small way we can do that. So thanks very much for having me. It's lovely, and thank you again to the United Way for their continued support, and to the partners. It's wonderful to work with them in this cooperative way.
Wonderful. Thanks, Renee. And Marc, before we turn it over to any questions from the audience, any final thoughts you want to leave us with? Oh, Marc, I'm not sure if you got
This is
that.
a bit of improv. I'm sorry. I may have to go to another outlet here. I'm breaking up in this corner. So bear with me one sec. This is called improv.
No problem. And you know what? Oh. Well, maybe we'll see what kind of questions we have from the audience. Now, I know that there's been a lot of other funding coming from other sources to support seniors and other organizations during this time. We do have a question from one of our donors, but it's probably a question for Marc. Oh, do we have you back, Marc? You just got to unmute there. Oh, we can hear you. Oh, okay. You know, we're improvising. This is what happens with technology, eh? So, you know, it isn't always perfect, but we're making it work, people. So thanks for being patient with us as we work through these technical difficulties.
All those years on the news desk. I'm back.
Yeah. Okay, well, we can hear you loud and clear now, Marc. So that's good.
Yes.
Well, so Marc, we're now.
I just want to say corner offices are overrated. There's evidently no Wi-Fi.
Well, I want to actually just, we have a question from one of our audience members, one of our donors that I want to, it's actually more directed to you, Marc. So hopefully we can, you're feeling good about answering this one. So one of our questions is actually from one of our donors, John. He wants to know, how does United Way Greater Victoria tie in with relief funding?
So the Rapid Relief Fund specifically?
Yeah, Rapid Relief Funding, but also all the other funding that's been coming from the pandemic.
Great question. So in March, when we launched, we were actually, I think, the first formal fund to be launched. We were in discussions with Rapid Relief, which is a wonderfully generous initiative of the Joel Family Foundation, the Times Colonist, and the Victoria Foundation. We very quickly mobilized to keep in very good touch as to with these emerging needs left, right, and center, how best we respond. And through that, we wanted to guard against duplication. But clearly, in March, and so much has happened since, and so much continues, but food and shelter and isolation were absolutely first and foremost. So we're in constant dialogue. We directed funds through our fund. Rapid Relief was directing in certain areas. And we were ensuring that we could get to as many parties with the maximum impact that we could. So, and then federal government funding started to emerge as well. So a number of moving parts, and we've managed our way through those. So I think good dialogue, collaboration, understanding what the needs are, and being very quick to respond to them.
Great, thanks, Marc. You can hear you loud and clear now, so that's wonderful. Any last questions from the audience before we sort of close up our webinar this morning? Okay, great. Well, I'm going to just turn over to you, Marc, for closing remarks, and we'll end it there.
Well, first off, thanks for everyone's patience, you know, working through this process. And I especially want to thank Glenys and Renee for providing on the ground insights, both practical, most importantly, heartfelt. Really appreciate the work you do every single day, but you've provided, I guess, our guests with some really insightful background to the program. So thanks for taking your time today, and to you and your teams for all you do every day. And for that 10 or 11-year-old volunteer that with a smiling face, I have no doubt. As all are aware by now, this is a central program for us at United Way Greater Victoria and for our community. It will be a key focus of our fundraising efforts and our collective efforts to improve upon this and respond to needs within our community. So We are grateful for your consideration for those who have supported us to this point and in anticipation in future. Our sincere thanks. You can learn more about the program from any one of us here at United Way, and certainly at our website at uwgv.ca. I have to say there's a /donate, so a very specific ask there. But very importantly, it's about education, understanding, and responding. We did record this webinar. It will be posted on our website and will be shared on social media. For those of you in the audience, we're most grateful for your time. We thank you very much for attending here today. It's not a numbers game. In terms of these, this is our third. It's all new. Every one of these is an experience, as we demonstrated today. But we are quite specific in a more targeted audience. And so we're very grateful for your attendance and thanks for being here. Our fund continues, in fact, into what has traditionally been known as campaign. These are the themes. It's about living through COVID-19 and what are these needs, and isolated seniors are front and center within our theme that's underway currently. I want to thank Jenny very much for such a solid job moderating. You managed to stay in your seat, throughout this thing, unlike me, and you did a great job. So again, thank you all very much for attending today. We appreciate your support, your generosity of your time and your resources, and I wish you all an excellent day. Thank you. That concludes the webinar for today. Thank you all very much.